And the other thing that we've bought a tremendous amount of is the hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably. It's a powerful drug on malaria. And there are signs that it works on this, some very strong signs.
Yeah, I mean,
I've seen things that I sort of like. So what do I know? I'm not a doctor. I'm not a doctor, but I have common sense.
Okay, so
Very quickly, is hydrochloroquine preventative against this virus? Yes or no?
you know, as I've said many times, Margaret, the data are really just at best suggestive. There have been cases that show there may be an effect, and there are others to show there's no effect.
Okay.
So I think in terms of science, I don't think we could definitively say.
Mr. President, as President of the United States, your words carry enormous weight in this country and around the world. And while you acknowledge you're not a physician, you do promote these medicines extensively here. How do you not go so far as to be giving medical advice?
But we don't have time to go and say, gee, let's take a couple of years and test it out. And let's go and test with the test tubes and the laboratories. We don't have time. I'd love to do that. But we have people dying today. As we speak, there are people dying.
The doctors who are treating coronavirus patients, they have the medical expertise to determine whether or not they should prescribe hydroxychloroquine.
And many of them
And
do.
there are already clinical trials in place
Sure.
looking at hydroxychloroquine.
Sure.
So
They should be
why
finished in
not-
about a year.
Why not just let the science speak for itself? Why are you promoting this drug?
I'm not. I'm just
You
saying,
come
very
out here-
simply, I'm not at all. I'm not. Look, you know what I'm trying to do? I'm
Well,
trying
you
to save
come out here
lives.
every day, right, sir, talking about the benefits of
I want them to
hydroxychloroquine.
try it, and it may work and it may not work. But if it doesn't work, it's nothing lost by doing it, nothing. Because we know long term what I want to save lives. It may not work, in which case, hey, it didn't work. And it may work, in which case it's going to save a lot of lives. Now, a lot of people say if the people walking in prior to getting it, if they take it, it has a profound effect. Well, maybe it does, and maybe it doesn't. I don't want to wait a year and a half to find out. And only CNN would ask that question. Fake news. Go ahead.
sir, I have one for
Bunch
you
of
on oil, but
fakers.
first,
Could you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
that question?
Yeah.
Well, I'd love
Maybe
to hear from
15,
the doctor.
15 times. You don't have to ask the question.
He's your medical expert, correct?
He's answered that question 15 times.
Dr. Fauci, why are you